I was first diagnosed when I was right before my 21st birthday. I was actually living in upstate New York, working in theater, summer stock between my junior and senior year of college. I had to kind of give up my dreams and kind of come back to West Virginia so that I could start pursuing a career in something else. This was late 90s, early 2000s. I mean, I felt like coverage was pretty good. You know, it wasn't really, I didn't have a lot of the struggles that I've had in more recent years. I think I would speak for a lot of diabetics that I think we kind of get pushed around a little bit by the insurance companies. They kept changing the tiers that my medication was on. And I mean, it would be astronomical. And even with insurance, I was a single mom and, you know, couldn't afford that. And so my doctor would have to go back and find another formulary so that it wouldn't be such a high cost. At one point, I just cried because I felt like I was doing really well. I felt really comfortable with what I was taking. I felt like, okay, this combination of medications is really working. And I got the letter and I just bawled because, you know, even though the medications are supposed to be the same, what works amazing for some people doesn't work at all for others. You know, it really is person specific. At one point in terms of copays, last year, I know I was paying over $200 a month for insulin alone. And that's with insurance. And that was for a 30-day supply. So for $200 a month, you know, for a single mom, it's really challenging and it's difficult. And you feel really frustrated because you have to have this to live. It's not like it's an option. Insulin, I take two different kinds. I take one that kind of does the basal rate, keeps you on an even keel, keeps your baseline. And then I take another kind, it's a fast acting, and that's for when I have meals or I need to treat a high. Those two insulins cost me about $90 a month. Then I have my glucose monitor supplies for my continuous glucose monitor, and those cost about $90. And then I also have to maintain a regular meter for finger sticks because you need to make sure that your continuous glucose monitor is accurate. So you've probably got about another $20 a month just in test strips. And then you also have to have, if you do have a diabetic seizure and you're unconscious, you have to have either glucagon or they have a new nasal spray. So you have to have some of that. And those usually run about $30 or $40. And then I always keep glucose tablets on hand, you know, by your bed in case you have a nighttime low. That's about another $10. So it gets a little pricey. There were times I did have to ration insulin. And I mean, I'll be honest, I had to do it even as an adult living back in West Virginia. And my bills would be higher one month, you know, during the winter or something. And so I'd realize that my vial wasn't going to get me through 30 days. When your blood sugar is high for an length of time, I mean, it damages your kidneys, just about every organ in your body is affected. It can really lead to more serious health conditions that are going to cost more, that are going to cost the government more, you know, to help, and insurance companies and everybody, and the medical professionals and everybody. It's going to all cost more. So you would think that they would want to give us what we need to prevent us from having to, you know, have those complications. Everybody knows somebody who's diabetic. We need to treat everyone equally and allow everyone to receive the care that they need and get the medication and supplies that they need to survive.